Uh, can you explain a little bit about what is essential tremor? The initial video that I showed about Mark Robert, the heating engineer in UK, he had essential tremor, quite a lot of shaking. Can you explain to us what is essential tremors and how DBS can help?
Yes, sir. Essential tremor is like there are several types of tremors out there. Like if you take essential tremor, dystonic tremor, drug-induced tremor, or patient can have like a task specific task they will have tremors. There are several types of tremors, but the most common tremors are the essential tremor, or what we call it as a familial tremor. So the patient's father or grandfather or anybody grandparents will have that tremors. Subsequently, the father, son, everybody like familiarly they can have tremors. But this essential tremor, usually when it starts, it will be mild, maybe one hand initially. Within few months, they can have tremors, both like this very mild. But when the disease progresses like 5 years or 6 years, 10 years, they will have lots of tremors. So the important point is whether what we should take into account, whether the tremors are interfering in their day-to-day life activities. Like if a male, whether they are able to shave, or they are able to hold a spoon and cut the food and bring it to the mouth properly, or when they are holding a cup of coffee, whether they are able to bring the coffee properly or they're spilling it, or when they are doing their work like buttoning or while writing, whether all these things are interfered or not, whether they are able to do their day-to-day activities without any trouble. So that is the important thing what we need to do. So if they have troubles, we will always try to start the medication. Like initially when the disease is very mild, we will give one tablet, propanol or something like that. Usually they will respond okay. Then when the disease slowly within 6 months to 1 year, the disease will progress. We will add other medication 2. Then we'll add other medication 3. So sometimes when we add or increase the medications, the patient will cannot like whatever the best treatment we offer. This type of essential tremor at some point of time will not respond to medication. At least if you take like 1,000 patients, only 30 to 40% of patients will have some benefit with the medication or for some time. After 5 or 6 years, depending upon every individual, at some point of time, these medications will not help. So as you see, Dr. Vishwanathan's patient, so that patient had lots of tremors. So I will show you another patient, which is mine. I have seen a couple of years back when I was in Ireland. Show you this one. Yeah, this gentleman. You can see. Yeah, so you can see there is tremors, lots of tremors. So you can see he has how bad is his tremors. He cannot do anything with these tremors. His handwriting is bad. He cannot do anything. His day-to-day activities is really troublesome. In another patient, if you look at this gentleman, similarly, I saw him in India. So I'm trying to bring out the tremors. You can see it's more on the left side. This is another type of tremor, most likely to be a dystonic tremor. See, whenever he holds a pen or whenever he is holding something up, it is difficult for him. So these type of tremors, when they are not able to do their activities of daily living, then if you take, usually these type of tremors will not respond well to medication. The best treatment what we have is DBS in these type of patients. When they are able to do their activities with medication, we'll try to maintain them with good medication. But when they have lots of troubles, we'll always prefer them to go for DBS. DBS is the best treatment of option we have for these type of essential tremors. Sir, do you want to add anything else, sir?
No, I mean, you've covered most of it. And just want to pick a couple of questions that are related, which I've answered on the chat button as well, is how to differentiate between Parkinson's disease, essential tremor, and one more condition that we will discuss following this as well. Is it treated with levodopa? No. For everything, levodopa is not the only drug. There are various other drugs that can help. So that is the reason why somebody like Dr. Vijayashankar, who has the experience to distinguish between some of these things, which can sometimes be very difficult to discern. Sometimes two things can be together. Why this is important to discern is, one is to find out what medicine can work. Is there a medicine in the first place? Because there are some types of Parkinson's disease, the Parkinson's plus syndromes, which he had mentioned, for which really we can give medicines, but there is nothing really that really works other than supportive therapy, physiotherapy, and things like that. Therefore, the important thing is to diagnose it correctly, so that for essential tremor, the electrode is placed in a different area, and that can sometimes lead to dramatic improvement. Again, most of the times, I should say. Body imbalance can be part of this, part of that. So it's too vast. I mean, we cannot cover the entire neurology or movement disorders neurology in this webinar, but it's too vast, and that is why somebody who with experience in this subspecialty is needed to look at the patient closely. Do the patient require therapy after DBS? The patient requires therapy both before and after the DBS. In Ramachandra, we work closely, as I said, with the speech therapist, with physiotherapists. There are various parameters that can be used in DBS that can improve the speech or worsen the speech, improve the walking, worsen the walking, and things like that. In fact, we are doing currently a research project in Ramachandra on various simulation parameters that can, help with speech. So, towards the end of this, Dr. Vijay will also mention about the upcoming webinars where we will involve our team members as well, exclusively to talk to you about what sort of therapies are helpful.